Hey there, it's Dr. Jeremy again from the Electroacupuncture Institute. If you've been treating blood sugar issues and not getting the results you want, this video will change the way you approach type 2 diabetes. And remember to download the free clinical resource, use it today, and don't forget to like the video, tag a colleague, and drop a comment if this speaks to your clinical experience. Let's get to it. All right, let's talk about a very common disease that our patients face, diabetes, right? A lot of times our patients come in and they say, hey, I have diabetes, I'm on metformin or I'm on insulin, whatever medicines or they're on, the treatment for us is typically the same. First off, I want you to start thinking about the earth channels. So come look at this. Let me refresh your memory. We always follow this three-step diagnostic process. Step one is which acuchannel, tissue, or neural level is deficient. In diabetes, typically it's the earth and/or fire channels. Why is that? Because the earth channels feed the entire endocrine system. Isn't the pancreas responsible for producing different things like insulin? And it becomes less effective and it's part of the endocrine system. So the earth channels are the entire endocrine, genitourinary, and mesoderm systems of the body. Now, why are the fire channels related to diabetes? That's because the autonomic nervous system is part of the fire channels. The triple energizer is the sympathetic system, and the pericardium is the parasympathetic system. And so doesn't sympathetic dominance decrease the amount of stomach acid and pancreas function, stomach function and pancreas function? Absolutely. We need to sit down, relax, get our patients into a strong parasympathetic tone to have them digest and help them with their diabetes. Now, what tissue is deficient in diabetes? Typically the pancreas. That's a good place to start. And what neural level is deficient? Well, I'm going to show you the neural level of the pancreas, because the pancreas becomes deficient in electricity. That makes the neural level feeding that pancreas deficient, or vice versa. Okay, now let's go into how to locate and find the pancreas point. First, we need to learn how to, and I have another video on this in YouTube, how to find vertebrae levels. How you do that? Well, there's a little notch here, or this is the occiput and the start of C1. Then if you run your finger where the angle changes is C7T1. Then you run your finger again, and where the angle changes is T12L1. Run your finger again, and where the angle changes is L5S1. Now, this is just an artist's representation of the spine. Every patient's different. I want you to find these spinal levels by finding where the patient's ear changes angle. A lot of times, this sacral area I'm finding under this flap here, and this is the lumbar area here, and then this is the thoracic. A lot of times, but not in every case. So if you find the landmarks of C0, C1, which is right here, where the angle changes, another landmark C7, T1, where the angle changes, another landmark T12, L1, and where the angle changes, another landmark L5, S1. So let's say you know the pancreas is at T8, T9 area. Well, find these two landmarks. So C7, T1 here, T12, L1 here. Then divide this into 12 parts. So halfway is about 6, and then a few more is about 9. Once you find T8 or T9 roughly, then let me show you what you're going to do. So what are you looking at here? You first find that vertebrae T9. You roll off to the upper third or half of this concha wall here. That's where the spinal nerves are. Okay? And so you first find the vertebrae. We're targeting pancreas, which we know is T8, T9. So I find T8, T9, then I roll off to the upper third of this concha wall here. Now, let's look at where the actual pancreas point is. And you will see, I like to treat the pancreas on the left side of the body, so which means left ear. Look, it's around T9, T8, T9, and on this upper surface, upper half or third. So I would take my point finder in the general area if it reads below an 8 on that point finder, or if there's tenderness in this point, if you're using a pressure probe, this is where I treat it. I stick a needle and I treat it for 20 minutes and I insert electricity. I love 10 hertz here. The pancreas is made up of mesoderm. 10 hertz works great. You will be charging up the pancreas, improving pancreas function, and if you're adding in the earth channels, rectifying the entire endocrine system, and adding in the fire channels if they're deficient, thus correcting the autonomic nervous system, and treating this for 20 minutes, which gets a parasympathetic response in the pancreas and some of the other tissues. That's a super powerful way to treat diabetes. Remember, they're already coming in diagnosed. They're like, I have diabetes and I'm on these medicines. Well, bam, now you can convert that diagnosis into our land, which is diagnosing the terrain of the acuchannels, tissues, organs. And we've diagnosed their pancreas is deficient, we've diagnosed their earth channels deficient, and that their fire channels are deficient, and then you treat accordingly. Now, one thing is, as the health of these tissues and their endocrine system and their digestive system improves with your treatments, they're likely, if they're on insulin, gonna need to slowly come off insulin. So you need to work with the primary care provider because their insulin is gonna need to be decreased. You don't need to work with their primary care, but it's a very good idea to work with their primary care. If they have diabetes, they're generally going to see their primary care doctor every 3 months, and that's a good amount of time for them to mention, you know, maybe I can take a little bit less insulin because my blood sugar numbers have been way better because I've been getting therapy or treatment. Now, if you're tired of seeing diabetes cases stall or relapse, this is a great place to start. Use it on your next patient. Remember to tag a colleague who needs this. Drop a comment if this hits home. And for more trainings like this, visit electroacupunctureinstitute.com. See you in the next one.